Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us today. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, January Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Aaron Brescia, board certified head and neck surgeon from Ohio Head and Neck. Good morning, Dr. Brescia, and welcome back to the show.
No, thanks for having me. Excited to be here.
Allergic rhinitis, also called hay fever, is an allergic reaction that causes sneezing, congestion, itchy nose, and sore throat. Pollen, pet dander, mold, and insects can lead to hay fever symptoms. Hay fever can make you feel awful, but you can find relief with lifestyle changes, allergy medications, and immunotherapy allergy shots. This morning, we're going to talk with Dr. Brescia about allergies, sinusitis, and Ohio Head and Neck Surgeons Ascent Surgery Center. The Ascent Surgery Center means you and your family have a choice. Your family's ear, nose, and throat outpatient surgery can now be performed closer to home at the Ascent Family Surgery Center by the caring doctors at Ohio Head and Neck Surgeons. If you or a loved one suffer from allergies or sinusitis, you won't want to miss today's show as we discuss allergy and sinus treatments with Dr. Brescia. We'd like to remind our listeners that our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Dr. Brescia, welcome back to the show, and please introduce yourself and tell the listeners a little bit about yourself and your practice.
Yeah, so thanks. Dr. Aaron Brescia, one of the doctors here at Ohio Head and Neck Surgeons. Pretty much Canton's only a full service ear, nose, throat practice. We've been here well over 40 years, and yeah, and there's four of us now: Dr. Kent Ramsey, Dr. Charles Bogdan, Dr. Daryl Smith, and then myself. And so yeah, we've excited to continue to provide good ears, nose, throat care to the patients in the greater Canton area.
So what are the most common allergies?
Well, we tend to break down allergies in perennial or all year round allergies versus seasonal allergies, things like trees, grasses, weeds, and ragweeds. Common perennial allergies are all year round allergies, include dust, cats and dog dander, feathers, molds, versus, again, seasonal allergies like trees, mostly in the springtime, then grasses in the summer, and then ragweeds and things more in the fall. So we see a lot of patients with allergy problems either year round or just seasonally.
We used to call everything hay fever at one time, didn't we? And I think that term has kind of gone away, hasn't it?
Yeah. It's a pretty generic term for usually seasonal allergic rhinitis. Yeah, absolutely.
I can remember my mother years and years ago, and that was she had a horrible hay fever,
Right.
And every August, I mean, it was just.
That's ragweed.
I remember one day we little kids brought in a bouquet of ragweed flowers for her, and she just ran the other way.
Yeah,
we didn't know anything about it, So what about how do you diagnose a patient with allergies?
Well, it's mostly about the history. Obviously, we'll do a physical exam, take a look in the patient's ears, nose, and throat, but you can usually get a pretty good clue that they're dealing with allergic rhinitis just from the history. Common symptoms, of course, are runny nose, postnasal drip, feeling like there are secretions running down the back of the throat, stuffy nose or itchy eyes, sneezing, sore throats. Those are all pretty common allergic rhinitis symptoms. Not typically, as not associated with fevers.
Yeah.
So the whole hay fever term is a little bit funny because if you're dealing with a fever, then those symptoms are most likely the result of a viral infection. And then people usually already know for themselves they're dealing with allergies because they'll say something like, every August I start to get stuffy, or I start to sneeze, or my eyes start to itch. So they'll pretty much tell you just with the history that they're dealing with an allergic rhinitis.
Do you see patients who have bleeding nose issues and stuff like that? Wouldn't that be like the worst situation out there?
Well, bloody noses for a lot of, we see a lot of bloody noses, especially in our older population, and especially in the wintertime. You start turning the furnaces on, that very dry air that you're breathing in through your nose can help thin out the membrane lining in the inside of the nose. And pretty soon things get almost like chapped in there. And just like when your lips get chapped, they dry out, they crack, and they bleed. And the same sort of phenomenon can happen in the nasal lining.
Okay. So, it's 20 degrees outside. Okay. So what about allergies in that sort of an environment? Do they go away, or are they still there?
Yeah. So after the first few frosts in the fall, we can expect a lot of the outside pollens to sort of be dormant. So if allergic rhinitis symptoms persist into the wintertime, that's your hint that you're probably dealing with something perennial, like a dust allergy or an allergy to pet dander. So we're going to try to elicit these types of details in the patient history whenever we see these complaints.
Let's see. So what's the best medications to treat these allergies?
Well, I personally try to manage allergies long-term without pills. That's just my own preference. I'd prefer to manage allergies with nasal sprays, either, usually nasal steroid sprays.
Sure.
The one that everybody knows is Flonase or fluticasone. But there are also antihistamine nasal sprays, and I'd prefer to start there and see if I can manage allergies well just by delivering medicines in the nose, as opposed to taking pills that can have all over what we call systemic adverse effects. But if I can't get a foothold on symptoms just with medicines in the form of nasal sprays, then I'll usually start to talk to patients about.
Okay, it's got to be about 90 out of 91 patients who say, I can't put anything in my nose. I mean, and all the people I've talked to over the years, I've suggested nasal sprays. I use them myself. Okay, I don't like taking massive amounts of pills. Okay, so
well, and then they stop working, right? I mean, everybody, most of these patients have a history where they took Zyrtec for a year and it worked well, and then it stopped working. So now they're taking Allegra, and then that stopped working. And that's the problem with antihistamine pills, for sure, that your body eventually stops kind of responding to them.
There's a new over-the-counter nasal spray that's been out, not too awful long.
Right, Azolastine.
What are you thinking about that product?
Yeah, that's great. So, Astepro or Azolastine was prescription for a long time, and now just recently became available over the counter. Yeah, as opposed to Flonase, which is a nasal steroid spray, Azolastine is a antihistamine spray. But again, which is a good choice to manage allergic rhinitis, but I like it because you're just delivering the antihistamine in the nose where you need it. And again, you're not taking a pill and subjecting your whole body to it.
I never had allergies when I was younger, but as I age, I'm affected by more allergies. Is it normal or?
Yeah, I get this question all the time. I'll start asking somebody who's got allergic symptoms, do you have cats or dogs at home? And they go, yeah, but I've always had dogs. And I go,
yeah,
that's true. But really all you need, unfortunately, to develop a new allergy is a previous exposure to something. So if your body decides at some point to make the antibodies responsible for the allergic response, then the next time you're exposed to that thing, you're going to have allergy symptoms. So unfortunately, it's not predictable. Just by having a long exposure to something doesn't mean you could never develop an allergy to it.
I see.
So that we hear that not infrequently.
Okay, doctor, we're going to take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy.
Hi, Paul White from the Medicine Center Pharmacy. I'm happy to report that we've been fortunate to purchase the Dartmouth Pharmacy of Canton. All prescription records have been transferred to the Canton Medicine Center Pharmacy on West Tuscarawas Street. We have already met and transferred many former Dartmouth Pharmacy patients and have hired the staff to work in our Canton store. So please stop by and check out our super pharmacy. Any questions, please call the Medicine Center in Canton, 330-455-5422. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy. Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Christmas Wonderland for the Studio Arts and Glass Holiday Open House. Shop our yearly pre-season sale for 20% savings off hand-blown glass, unique jewelry, pottery, and of course, stunning stained glass. All handmade in America. Don't forget, we're open extended hours for the holiday. The Holiday Open House at Studio Arts and Glass in North Canton on 77 in Apple Grove. Come in today.
Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, don't forget to stop in for your flu shot or COVID booster. Walk-ins are welcome and appointments can be made on our website, medshoprx.com. We look forward to helping you stay healthy.
All right, doctor, let's talk a little bit about allergy immunotherapy.
Great. So again, when we feel like we're not getting good enough control of allergic rhinitis just with medicines delivered by nasal sprays, there may very well be a recommendation to start immunotherapy, or what are commonly known as allergy shots. Allergy shots are a well-established way to try to develop long-standing blood chemistry changes so you stop reacting to these things that aren't harmful to you, like dust mites or molds or dog dander. So they're very effective in controlling symptoms. What we consistently see is that patients need to reach less often for Zyrtec or Allegra antihistamine pills to control symptoms. And that's a great response. What's a little bit less predictable is which patients are going to go ahead and develop the long-term immune changes so that ultimately they stop reacting to these things. That's tough to predict. We typically recommend a term of at least 3 years before we start to sort of try to ascertain if we can get somebody off of allergy shots.
Okay. So I guess that kind of covers, allergy shots don't have to be forever then. Is that correct?
No, ideally they won't be.
Okay.
Yeah. But what we've seen is that when if people do them for a shorter period of time, like a year, they have a nice response. They do it for a year and they think, well, I don't have allergies anymore. Those benefits, unfortunately, tend to be short-lived.
Okay.
So that's why we usually suggest an initial treatment period of at least 3 years. These are weekly to start injections, small injections of purified protein versions of the things that we know you're allergic to in very dilute concentration. And the idea is that we are inducing the body to generate a specific population of antibodies that can compete with and crowd out the population of antibodies that are responsible for the allergic response. So we're basically creating a tiny arms race in your immune system and hoping that this new population of antibodies can crush the initial antibodies responsible for allergies.
Okay. I don't know if this is relevant, but your description there makes me think of some analogies, which I don't know if it'll help listeners, but it almost makes me think about it's the same concept or a similar concept with homeopathy, where you use small dilute concentrations of something
Right.
to help support a symptom, or even another loose extrapolation of maybe a vaccine where you introduce those, like a killed flu vaccine, a killed flu virus into your system to help the body build up antibodies to those. So
That's exactly
I never
right.
realized that's how allergy shots work. So
Yeah, it's essentially, sometimes we'll actually refer to them as vaccines.
yeah,
Because
okay.
essentially, it's the exact same concept, except that, again, we're trying to treat things that aren't inherently harmful to you versus what we traditionally think of as a vaccine, some kind of invader that is harmful to you, like the flu or COVID.
Okay. All right. Earlier in the program, you mentioned allergies can change over time, and I thought your analogy with the dog was interesting. But I don't know how much, if at all, you guys deal with foods. It seems like, you drink orange juice your whole life, and all of a sudden you get a little bit of food intolerance to that. So it almost seems like overexposure to anything is probably a bad thing, and you need to kind of rotate your environment in some fashion. So
food allergies are a little bit more murky as a science, partly because not every, and I'm glad you used the term intolerance, not every intolerance is allergy mediated. Some of those are enzyme deficiencies where you don't, for instance, milk intolerance is often not an allergy at all. It's somebody doesn't have the enzyme machinery to break down lactose as efficiently as other individuals. And so when they have a load of lactose, that gives them GI gastrointestinal problems. That's not an allergy. So yeah, it's a little bit more difficult to sift through when people have a food intolerance. The other issue is, by and large, food allergies are a little bit more difficult to manage. What I usually tell patients is, yeah, we'll get food allergy testing. And if there are reactants on those tests, it doesn't necessarily mean that you're truly allergic or that you're truly having a clinical problem. Some foods, like for instance, peanuts, have multiple proteins within them that have the capability to induce a positive allergy test response, but might not be actually clinically relevant. And so it's a little bit more difficult to interpret. What we usually tell patients with an array of food allergy responses on their test is, unfortunately, the onus is on them to go through, systematically eliminate foods that they've reacted to on this allergy test. And then one by one, if they want that food in their life, introduce those foods at a small dose, monitor for symptoms. And if they do okay, eliminate it, and then pick another reactant, add that back in, and monitor for symptoms and try to figure out which of these things is actually giving you a clinical problem.
Yeah.
Gosh.
So, we touched a little bit about environment too. What can we do in our homes? So if you're set off by something airborne, can you help patients nail it down to, is it, maybe down pillows or fabric softeners, or what can you
Right.
guys do to help patients with that kind of challenge?
So the easy ones. So for instance, pets, obviously, I've never once told somebody, well, you need to get rid of your cat. There's no point in saying that. I'm a pet person. So, but yeah, that's a difficult, when you're allergic to your own pets, that's a tough one to manage. And I usually start talking to those patients about allergy shots. That might be, if you're allergic to cats and you have cats in your home, that's a lot to ask of Flonase to control. And again, I try not to ever tell a patient, well, just take these pills every day to manage your allergies long-term. So that's when I'm usually starting to bring up allergy shots in conjunction with a good nose spray used on a daily basis. Things like dust allergy is one where you can really implement some measures in your home to decrease your exposure to dust. Your heaviest exposure to dust in the home is typically in bed at night. And so if you can have a good air filter with in your air purifier in your room with a HEPA filter, dust covers for your pillows and mattress, those things can go a long way to decreasing your exposure to dust. It might also, something like a dust allergy, again, because your heaviest exposure is typically in bed at night, that might help me tailor when I recommend that you take your nose sprays. So we have to sort of look at the whole picture and see, well, how can we limit exposure to these things that you're allergic to in your home? Obviously, if you're allergic to your cat, it's a great idea to exclude your cat from your bedroom, where you're going to be spending hours and hours and hours at a time, when you go to bed. So we have to look at those things. There are pets that are marketed as hypoallergenic. That's not quite true in the literature. If you really look at it, several studies have shown there's really no statistical benefit to having this breed of dog over that breed of dog when it comes to allergic rhinitis symptoms.
So the hairless cats won't cut it then.
Yeah. That cat allergen is typically in saliva. So whether your cat has hair or not is really
interesting.
Yeah.
Okay. It is the bottom of the hour, time for our news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. So we're back to Health Matters. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Dr. Aaron Brescia from Ohio Head and Neck Surgeons. We've got a lot more to cover this morning, so let's get back to the show. So what about sinus problems? Are they related to allergies?
No question. So the problem with sinuses is they're not a great design. They're big empty spaces inside your facial skeleton with very narrow outflow tracts. So the lining tissues of the sinus make mucus all day long, and it's supposed to be swept up and out of these narrow hallways all day long, and you're not supposed to notice it. Unfortunately, anything that causes inflammation, either a virus, a cold, or an allergy, can block up these narrow outflow tracts, and then the mucus that you make there all day long can get trapped and then can stagnate and become infected. It can become its own source of inflammation at that point. So let's say you have a cold, you feel crummy for 5 or 6 days. Under normal circumstances, cold symptoms should start to abate after around a week, and you really should be feeling back to normal around 10 days. If that inflammation from the virus, the cold, clogs up your sinus outflow tracts and you trap secretions in your sinuses because of it, then unfortunately what can happen is your symptoms actually start to worsen after 7 or 8 or 9 days, because now those secretions have developed a bacterial infection. The cold, the virus has come and gone, but now you have a secondary problem. And that infection causes inflammation, which keeps the sinuses from draining. And that's how patients can get into a cycle of sinus infection, either from a cold or from allergies.
So how do you decide whether it's an allergy or sinus problem?
Well, part of it again is what we say periodicity. If somebody has the same symptoms, the same time of day, or the same time of year, and it's reproducible, you're probably dealing with more of an allergic response. If somebody says, my mornings are terrible, but I get up and I take a shower, and by the time I leave for work, I'm breathing better through my nose. My throat feels better. That's a hint. Maybe they have a dust allergy and they've been laying in bed all night long, reacting to dust. And so they have terrible mornings. If somebody says, I haven't been able to smell or taste my food or breathe through my nose for 3 months, then you start to try to tease out more specific signs of that could be sinus infection, especially very thick, opaque nasal secretions that are saturating Kleenex whenever they blow their nose, tasting salty, thick mucus running down the back of their throat, facial pain and pressure. Those are signs that maybe now you've developed into sinus infection, again, whether it be from a cold or from an allergic nose. And so those are the kinds of things that maybe elevate your suspicion. Oh, this patient has gotten into a sinus infection. We hope that we can get control of sinus infections with good medicines used for an adequate amount of time. Typically that includes something like a good nasal spray, like a Flonase, maybe decongestants like Sudafed to help calm the tissues inside the nose and allow the outflow tracts of the sinuses to open up so that the hair cells that line the sinuses can go ahead and sweep that trapped mucus out of there. And then a good antibiotic used for an adequate amount of time to cover the bacteria that are typically associated with sinus infections. And so we try to get control of sinusitis, infection in the sinuses, with medicines first. But if typically, then what we would do is, if the patient is still symptomatic, despite good medicines for an adequate amount of time, we'll probably recommend a CAT scan of the sinuses to look at the sinus cavities and see if there are secretions trapped in there despite good medical therapy. If there are, we're probably starting to think about maybe an indication for sinus surgery to physically open up the sinus outflow tracts, wash out the trapped secretions, return the patient to a clean slate in there. Then what we want to do is try to figure out, well, how did they get into this situation in the first place? If it's from allergic nose, then the onus is really on us to maintain a healthy environment inside the nose or sinuses so that the patient doesn't continue to get into sinus infection.
You know, many years ago, they used to give you a shot of Kenalog or some injections of that sort. Are we still doing that?
So Kenalog is a steroid.
Sure.
And steroids are very effective at controlling allergy symptoms. That is true. And in very selected cases, we do sometimes administer steroid shots to manage allergic nose. It is not a great long-term solution to manage allergies. Steroids have a lot of potential for a lot of adverse effects on the body. And so they should be used sparingly. I'm a little bit more conservative than maybe some other doctors delivering steroids to manage allergies. but there's just a lot more eloquent ways to control allergies, in my opinion.
Let's see. I just remember my father-in-law, who's long gone, but years ago, he'd get a shot like once a year or something. Oh, he'd be cured for,
Yeah.
for a
And
long time.
that's okay. Once a year, if somebody really has a terrible, let's say, grass season, and we know that they're going to really feel crummy from May till August, but they're pretty much okay the rest of the year. Again, I'd prefer to manage that with nose sprays, but that might be the patient that, if they absolutely can't tolerate delivering a nasal spray on a daily basis, that might be a patient that where I say, okay, take Zyrtec from May to August, or come in every May and we'll give you a Kenalog shot, and that'll get you through your season.
This was like 40 years ago, and of course we didn't have the sophistication in
Right.
sprays and stuff. And he was one heck of a gardener. I mean, he grew everything in the summer months. So, he was totally exposed to all the pollen, all this stuff like that. So
Yeah.
he really grew good corn and good vegetables.
That's good. That's good. Well, he must have wanted it.
He did. Blueberries, the works, man. So what testing can be done to diagnose sinus issues?
Well, good history and physical is obviously the foundation. If you're really trying to figure out if somebody is dealing with sinus infection, again, there are major and minor symptoms associated with sinusitis: facial pain and pressure, thick secretions, intense inflammation in the nose, and inability to smell or taste your food. Headache is a little bit of a minor criteria for diagnosing sinusitis. And then the other thing you really want to know is, well, how long have these symptoms been going on? Have they been going on for 6 days? You probably wouldn't start thinking sinus infection. But if they've been going on for 4 weeks, then probably the patient had a cold, it developed into a sinus infection, and that's why the symptoms are persisting. You want to know what sort of antibiotics maybe another provider has tried to treat this with, to see if it wasn't for an adequate amount of time, or maybe it wasn't a great antibiotic choice. And so you try to look at those factors to see how are you going to get this patient out of this mess, hopefully without surgery.
Interesting. Is surgery frequent, or?
Well, it's one of the more common things we do, especially in the wintertime. Again, it by and large is what we call endoscopic, meaning it happens with cameras up in the nose. There's no outside incisions. We're not leaving any scars behind. All of the instruments are designed to work in the nose and sinus cavities. And we do it by